Okay. So, a very good morning to you all. So, today what we'll be doing, students? So, today we'll be discussing on national health programs and what are the recent initiatives which the government has taken. So, we'll try to have a feel on what are the important things. So, it's not possible to cover in one session. So, today we'll be also taking, and subsequently also we'll be taking questions on national health programs and especially the newer things which have been added so that it becomes easier for you students to understand. Okay, and you should also be aware about the different programs which have been placed, and because national health programs, understanding of national health program, it becomes quite important, because there are changes, the global level changes, national level changes, so we need to be updated on that also. So with that, let me check. Yeah. So students, the first question for you is, uh, as per National Strategic Plan for HIV/AIDS and STI by 20 sexually transmitted infection by 2024, the achievement envisaged is it is 80% reduction in new HIV infection, 70% reduction in new HIV infection, 60% reduction in new HIV infection, 90% reduction in new HIV infection. So Parag has joined. Good, Parag. So Parag has answered 90% reduction in new HIV infection as per National Strategic Plan of Government of India. So let me put it in silent mode so that becomes easy. I don't get disturbed. Just give me 1 minute, students. Yeah. Good morning, Parag. So as you have answered, I can see anyone and any other students answering it. Just give a try. So National Strategic Plan for HIV/AIDS and STI by 2024. The achievement is 80% reduction in new HIV, 70% reduction, 60%, 90%. So I can see Parag has answered D. So let's discuss. Let's not waste time. Let me take my pen. Yeah. So you have answered D. Okay. Dhananjay Singh has also answered D. Okay. Let's take the discussion. But students, the answer is 80% reduction in new HIV infection, because this is the question on National Strategic Plan, Government of India by 2024. Okay, so it is 80% reduction in new HIV infection. So this is the first point which you should know. I'll discuss this, don't worry. Now the second question, students, take this. As per National Strategic Plan for HIV/AIDS and STI by 2024, the achievement envisaged is 90 is to 90 is to 90, 80 is to 80 is to 80, 70 is to 70 is to 70, and none. So Parag has again answered B. Deepak has answered A. Okay, so we have A and B. Anyone else? Dhananjay has answered A. So we have A and B answer. Neelu Bharti has answered A. Okay. So we have A answer also. Now students, let's move. The question is by 2024. Okay. Now you must have heard, we have heard a lot about this 90-90-90 concept. So whenever we see the options, our inclination goes towards, let's answer 90 is to 90 is to 90. But if you go by the document of National Strategic Plan which the Government of India has released for HIV and AIDS, they are saying something more. What is that more? So in this question, students, the answer is none. Why it is none? I'll just explain you. So just try to understand and remember this. The Government of India is saying that by 2020, see this year, by 2020, the NACO, means National AIDS Control Organization, will be achieving this many things. What is that? 75% reduction in new HIV infection. So this is 2020 students, 75% reduction in new HIV infection. They are also abiding by this 90s to 90s to 90, but the year is 2020. The question was 2024. Okay, so you need to know that by 2020, 90s to 90s to 90 has to be followed. Now, what is this 90, 90, 90? It's very easy. No need to see this literature written here. 90% of the people should know the status, whether they are HIV positive or negative. Out of those who are knowing their status, no, 90% should be under treatment. So the word which has to be remembered, status, 90% should know the status. Out of those, 90% should be treated, and out of those treated, 90% should have effective viral load suppression. So viral load should come down. So this is 90s to 90s to 90 concept. But this 90s to 90s to 90 is to be achieved by 2020. Okay. The third thing which they are saying, by 2020, eliminate mother to child transmission of HIV and syphilis both. Fourth is elimination of stigma and discrimination. Okay. So these are the four things which they are envisaging by 2020. Okay. Now coming to 2024, this was the question, students. Two questions asked on HIV. Both was by 2024. Now this 2024 means 80% of reduction in new HIV infection. So this is the first point. Second is 95% of those, just the same way, 90, 90, 90, just increase to 95, 95, 95. So 95% of those who are HIV positive should know their status. 95% should know their treatment, should get the treatment, and 95% of those who are on treatment should have viral load suppression. So what are the take home message for this? 90s to 90s to 90 is for 2020. 95 is to 95 is to 95 is for 2024. By 2024, students, you need to reduce the HIV infection by 80%. Okay. Yeah. So 90, 90, 90 is for 2020. 95, 95, 95 is for 2024. Just this was deliberately I gave this question for 2024 because I know students will answer 90, 90, 90. Because this is the common terminology now used either for TB also, HIV also. So it becomes important for you to know that 90, 90, 90 is for 2020. 2024 it becomes 95, 95, 95. Okay. So students, this NACO, this National Strategic Plan, just this slide will help you easily. It will help you to remember. New infection reduction by 80%, 2024. 95% linked to all those people who are suffering from HIV should be linked to the services. Ensure ART initiation retention 90%. Mother to child transmission you have to eliminate by 2020. Eliminate the stigma by 20 and provide the services by 2024. Now what is the outcome of objective 1? If you see, there are 6 objectives and you have got 6 outcomes. The six outcomes are, you want to reduce the infection. So new infection reduced from greater than 1 lakh to less than 21,000. Okay, 2.01 million people knowing their status, 1.9 million people living with HIV on ART. Elimination of the parent to child transmission and syphilis. HIV and AIDS should be considered as chronic manageable disease, and now integrate NACO, means National AIDS Control Program, with NHF. And there should be 100% domestic funding. So whenever you are revising about NACO and the new initiatives or the new target, just see this slide. This will help you to remember it for long term. Okay. Now, the next question, students. India HIV AIDS Prevention and Control Act was passed by Indian Parliament in, just give a try. India's HIV AIDS Prevention and Control Act was passed by Indian Parliament in? Parag is saying A. Let's see what others are saying. Dhananjay is also saying A. Okay. Anybody else who can give a try? Just give a try. No issues. Raghu Verma is saying A. Divya Palani is saying C. Okay. So we have A and C. So definitely we agree with that B and D are not the answer. So definitely it is somewhere in 2016 and 17. So the answer goes 2017. So sorry Majumdar and Divya Palani are absolutely correct. It is 2017. Now students, what is important? This act was passed in 2017. Now this act has got 6 components, students. This is a pictorial diagram. This will help you to remember. No discrimination as far as employment is concerned. No discrimination as far as educational establishment is concerned. Healthcare services has to be extended to all people irrespective of their HIV status. The people living with HIV can reside or rental property or renting property, no problem in that. Standing for public or private office. Provision of insurance means as normal, if I am HIV negative, so whatever services I am entitled to, the same services will be given to those who are HIV positive also. You cannot discriminate that. So for that, India has passed this HIV AIDS bill, no, where there should be no discrimination, and if discriminations are made, then he or she will be questioned. And there is an offense also, means if you reveal a HIV status except doctors and counselors, and that also for a specific reason, they cannot reveal, they cannot disclose their HIV status of any person. So this is the act. So you should know that the act has been passed in 2017. Good, very good. Now the next question, students, how many health conditions identified for screening under RBSK program? It is 30, 28, 34, 36. Just give a try. How many health conditions identified for screening under RBSK? Just give a try, students. Divya Palani D, 36. Priya Kumari B, 28. Anyone else with different opinion? Parag is saying 30. Okay. Anyone else? Okay. So we'll not waste time. So we have 3 options. We have 3 answers, 30, 28 and 36. So first of all, we should know, students, what is RBSK? It is Rashtriya Bal Swasthya Karyakram. Okay. So RBSK has got 30. So those who are answering 30 are absolutely correct. It's not 28, students. It's not 34. It's not 36. It is 30. 30 health conditions. Now, first of all, student, you should know that this Rashtriya RBSK, this Rashtriya Bal Swasthya Karyakram, is a child health screening and early intervention service program. Okay, it basically focuses on 4 Ds. It is famous saying 4 Ds: defects, birth defect, disease, deficiencies, development delay, and disability. So these are the 4 Ds on which RBSK is focusing on: defects, disease, deficiency, and delay. Okay. Now, when you know these 4 D, students, what is the age group which they are targeting? Under RBSK, Rashtriya Bal Swasthya Karyakram, they are focusing till 0 to 18 years age group. Okay, 0 to 18 year age group. Again, this 0 to 18 years age group has been divided into 3 subcategories. The first category is birth to 6 weeks. Okay, now birth to 6 weeks means 1.5 months. So this will be at facility or at the home, health facility or at the home. Then you have 6 weeks to 6 years. No, so this will be rural area and urban slums. And then 6 years to 18 years, you are taking the government or government aided schools. So in totality, the age group is 0 to 18 years. This again has been divided into 3. birth to 6 weeks, 6 week to 6 years, and 6 to 18 years. So what we try to find in this age group, the 4Ds. What is that 4D, students? These are the diseases: defect at birth, so 9 diseases; deficiencies, 5 diseases; childhood diseases, almost 6; and developmental delay, 29. And you have one more, they have added 30: congenital hypothyroidism, sickle cell anemia, beta. This have you put it in optional. So there are almost 30 diseases which they have mentioned in Rashtriya Bal Swasthya Karyakram. They have a mobile medical unit. They go in the field and they use Anganwadi centers. They go to the school to identify whether children are suffering from this or not. If they are suffering, they refer to the health facility for their further treatment. So this is RBSK program. Now, student, the next question to you is, Sathya is being hired under which program? So is it RKSK? It is RBSK, VHSND, UHSND? Just try, students. Sathya is being hired under which program? RKSK, RBSK, VHSND, UHSND? Give a try. Sorry, Majumdar is saying RKSK. Raghu is also saying Raghu is saying saying RKSK. Very good. Anyone else? Dhananjay, Priya, Deepak, A. So we have 3 A's. So nobody is going with RBSK, nobody is going with VHSND, nobody is going with UHSND. Okay. Now, student, even if suppose in case you are not aware, so just now we have discussed RBSK. So it is Rashtriya Bal Swasthya Karyakram. So Sathya is a very common term. Sathya means friends and all. So RBSK is basically identification of disease at the earliest. So that is done so that appropriate measures can be taken. VHSND is Village Health Sanitation and Nutrition Day. So it is a day observed on every Wednesday or Friday, whichever day is selected in a month, where the ANM, the Anganwadis, the Ashas, they come call all the people in those areas, and they have a meeting. Routine immunization also goes. Information about nutrition, sanitation is given, disseminated. The counterpart of VHSND becomes UHSND, which is Urban Health Sanitation Nutrition Day. So this is going for a long time. This is going for the long time. So even if we are not aware about what is this Sathya and all, so RBSK we know, VHSND, UHSND we have heard a lot. It is going in the field every month we conduct, where ANM, Anganwadi, Ashas, PRI members all participate. So routine immunization, nutritional efforts, counseling, antenatal checkup, everything is done here. So whatever we have studied about VHSND or UHSND or RBSK, Sathya doesn't fit. So what is this RKSK? RKSK is Rashtriya Kishore Swasthya Karyakram. Okay. So Kishore means adolescent. So whenever this word, if you know RKSK, even if you don't know the detail of that, no problem. Rashtriya Kishore Swasthya Karyakram means you are trying to handle the adolescent age. The adolescent age, so the best way of handling problems of adolescent is by becoming a friend. So let's make this catchy name they have given as Sathya. Okay. So Sathya is being hired under the program called RKSK. Now what is this Sathya, students? It's very easy. The adolescent in the community, means 10 years to 19 years age group, they are covered under RKSK under RKSK, a program called, the sub part of that RKSK is peer education program. So what we do, we select 2 educators, peer educators among the adolescent in that village. So these 2 peer educators are given the name as Sathya. What they do, 2 educator means 1 boy and 1 girl. How we select? We take the unit of village, like 1000 population, we have 1 Asha. So per Asha, per 1000 population or per village, whatever you take as a unit. So we collect two educators, okay? So one boy and one girl. Each boy or a girl is termed as Sathiya. Now what they will do, they will form a group of 15 to 20 boys and girls respectively. Boys will make boys group, girls will make girls group in the from the community, and they will conduct 1 to 2 hour, this is important, 1 to 2 hour participatory session under peer education kit. They will discuss about the adolescent things, what are the things which is important. So this is the concept of Sathiya. What has been also proposed, rupees 50 has been proposed for Sathiya as a monthly non-monetary incentive, so that they can be motivated to conduct this program weekly or means for 1 to 2 hours. So this is called Sathiya. Second, so that was about Sathiya. Now this will also help you to understand more about that. Adolescent Friendly Club. Adolescent Friendly Club, which is AFC, meetings is organized once in 3 months, 4 months, 1 month, 2 months. Just give a try. Is it 3 months, 4 months, 1 month, 2 months? So it is also the program. This is also one of the component of RKSK, Rashtriya Kishore Swasthya Karyakram. So you conduct Adolescent Friendly Club. So Rahul is saying A, 3 months. Divya Palani is saying B, 4 months. Priya Kumari is saying A, 3 months. Sorry, Majumdar is also saying 3 months. Okay, no problem. So the answer is 1 month. Parag was absolutely right. It is 1 month. Now, what is this adolescent friendly club, students? It is now what I just see the program structure. You have Sathiya now. Okay. So you have Sathiya, one boy, one girl. So what we are expecting from them, to conduct weekly meeting with the group, with the friends, colleagues of adolescent. So this is weekly structure. So what the government is saying, okay, you are doing weekly, let's on a monthly basis, at the sub-center, under the overall guidance of A&M, let's have the adolescent friendly club where we meet 10 to 20 Sathiyas. Now you will say, from where you are going to call this 10 to 15? If you see the concept, 1000 population on an average, we have 2 Sathiya. A sub-center is for 5000 population students. So it will be roughly around 10 to 20, it will be roughly around 10 or more than 10 also, whatever. So roughly what they are expecting, so they want to call 10 to 20 people of Sathiya, how many numbers are there. And this A&M will discuss with the Sathiya that what are their issues, what they are facing, any problem with conducting a meeting with the adolescent age group, and how A&M can chip in and help this Sathiya to conduct that. So for this meeting, where adolescent friendly club meeting, rupees 500 is provided to organize the session. So this is also a very new concept which has been introduced under RKSK, which is called adolescent friendly club. Okay. Now, this is the easiest one, student. Current neonatal mortality rate of India is 23 per 1000 live birth, 22 per 1000 live birth, 24 per 1000 live birth, and 26 per 1000 live birth. So Raghu, I think, no. Rahul has answered B. What is B? 22. Deepak has answered A. Sorry, Majumdar has answered A. Raghu Verma has answered A. So there are many A's except one person saying B. Now students, current neonatal mortality is 23 per 1000 live birth. Okay. Please students, I will request you all, whenever you are going for any exam, and if you are revising this important indicators like under 5 infant mortality, neonatal mortality and all those, crude birth rate, death rate. So SRS, just go to the SRS website, just type SRS, this is a part of census. So just see what is the latest update. You never know, sometimes they publish it when we are aware very late. So at times we can be wrong also. So what is the current under 5 mortality students is 37. So don't forget this. Infant, out of this 37, 33 are infants. Out of this 33 infants, 23 are neonates. Out of this 23 neonates, 18 is early neonate, means 7 days. This 5 is late neonate, means after 7 days. And this 10 is post neonate. So if you add these students, these three, it becomes what? It becomes infant mortality. So this happens to be infant mortality. If you add this, it becomes neonatal mortality. Okay. What is the perinatal mortality? It is 23 because it includes early neonatal and stillbirth. So stillbirth is 5. So always students, whenever you go for any exams, because these are the important indicators with regard to India, so always have a check that as has the new SRS publication came. If it has come, it will be there on the website, so it will be easy for you to just cross check. But as of now, this is the latest data. So whenever anybody asks you, you quote this 37, 33, 23 and all this. Okay, don't get confused with 24 or other indicators. Now the next question is, under free diagnostic service initiative of NHM, which National Health Mission, how many tests are available at sub-center? Okay, so the options are 9, 19, 57, 18. Just try, students. What is the answer under free diagnostic services initiative of National Health Mission? How many tests are available? Parag is going with 9A, which is 9. Anyone else who wants to try this? Okay, Rahul has also tried A. Good. The Dhananjay Singh has answered B. Okay. So the question is free diagnostic services initiative of NHM. Now, under health system strengthening, the government of India is providing free diagnostic services at different levels. So how many diagnostic services are free at each level of healthcare system? That has to be known. So if you go, what are the free services available, means how many numbers of free diagnostic services available at sub-center, that happens to be 9 students. Okay, so at sub-center the services which are provided is 9. So just why we provide free diagnostic services? Because when you go for a diagnosis, laboratory diagnosis, you have to spend money. So what it has been seen that 10% of out-of-pocket expenditure is on the cost of diagnostic. In that 10% of out-of-pocket expenditure, 11% is in OPD and 9.6% is in IPD. So this out-of-pocket expenditure by patients, by the people, need to be reduced. So how we can reduce? By providing free services. Now what are the services? How many services? 9 tests at sub-center, just remember this, 19 tests at PHC, 39 tests at CSC, 57 tests at district and subdivisional hospital. Okay, so 9, just remember like this, 9, 19, 39, 57. Start with 9 sub-center, 19 PHC, 39 CHC, 57 subdivisional hospital or district hospital. So this is the way just you need to remember it. Okay, now how many MMU can be there for a district? What is this MMU? Mobile medical unit. How many mobile medical unit can be there for a district? Maximum 5, maximum 4, maximum 3, none. Just try, students. Come on, Raghu, Divya, Arun, Rahul, Parag. Just give a try. How many mobile medical units can be there for a district? No clue? Okay, let's not waste time. So how many mobile medical units we want? So that is also a part of National Health Mission. They have mentioned that there should be a cap of 5 mobile medical unit. Normally it should not be more than that, normally, ideally, but there are certain provisions where you can have more than 5 medical units also. So let's try to understand what is the concept is, for every 10 lakh population students, you will have one mobile medical unit. Okay. So district having population of 10 lakh, so one mobile medical unit. So this is the way you move forward. A district with a population of 10 to 20 lakhs, so you will have two mobile medical units. 20 to 30, three mobile medical units. 30 to 40, four mobile medical units. Now a district with more than 40 lakhs, you have an upper cap of 5 medical units. Okay, for 5 mobile medical units. But this is the upper cap. However, in tribal areas and hilly area, this norms which is set, this is not fixed. No, this is not fixed that you have to follow this. It can change in northeast area where the population is very scattered. So in population less than 10 lakh also you can have one mobile medical unit. So that is the means benefit. It is flexible. But this is the normal norms. For 10 lakh population, we have one mobile medical unit. And then you proceed like this: 10 to 22, 20 to 33, 30 to 44, and 40 and above 5. That is the cap. Okay. Great. Now, next question, students. Involvement of families of sick and preterm newborns as partners in caregiving and decision making in the newborn care facility is called as family participatory care, family involvement care, family responsibility care. None. Just try. Raghu, Parag, Divya, Arun. Involvement of families of sick and preterm newborns as partners in caregiving and decision making in the newborn care facilities is called as what? So Parag is going with A, family participatory care. Anyone else? Saurabh Majumdar, family involvement care. Okay. So this is the new initiative under child health by Government of India, where what they want to involve the family also. So the program is family participatory care. Now what is this family participatory care? So families response to the kids, for the newborns will be of supreme importance. They will be giving their level best to ensure that their kids are fine. So what the government is trying, the government is trying to involve the family also, not in giving technical treatment. The technical treatment, the overall responsibility lies with the government, lies with the doctor, lies with the paramedics. But what they will be doing, they will be involving it so that they understand the problem of the child and they can extend services as guided by the doctors or the nurse. So that if the child recovers, goes back to the house, the family can take care of, and family is also involved in the treatment of newborn care. So that is called family participatory care. Okay, new thing added. So this will be the last one. What FDS stands for in family planning program? What is this FDS? Arun, Raghu, Priya, Divya, Parag. Just try this, students. What is this FDS? What is FDS stands for in family planning program? Is it fixed day static strategy? It is fixed day service. It is first day service. None. Parag is saying fixed day survey. Okay. Rahul Dhanova is fixed day strategy. Anyone else? Divya is going with B, fixed day survey. Okay. So there are B and A. So students, whenever this FDS word comes in family planning, I'll just give you one example. Whenever this FDS comes, think of Supreme Court, Honorable Supreme Court of India. And once I finish this class, just type on Google who is Devika Biswas. Devika Biswas. She is an activist. She is an activist who fought a case with the government of India. Why? Because initially what was going on, family planning program, the operation, sterilization operation, female sterilization, male sterilization, may not male very less happens. Female sterilization in particular used to happen in camps. Now also it is happening, but it is very less now because Supreme Court has told the given directive it cannot happen in camps. So what Devika Biswas did, filed a case because there was a camp organized in Araria district where many females, no, after operation died just because of negligence. Because you are doing in a operation, a female sterilization operation in a panchayat bhavan, in a school or sort of those things where you don't have the facility. So the Supreme Court gave a directive to the government that you have to ensure that you have a certain guidelines on conducting this family planning permanent method of sterilization. So they said that let's go with FDS. What is this FDS? Fixed day static strategy, students. Now this FDSS, ideally it should be FDSS, but in saying we say FDS. Now each word has got meaning. Fixed. So fixed means you should not be mobile. What is that mobile come means? You are doing operation today, now here. So after 2 hours you are going to that place, or mobile you are doing the operation. So it should not be there. So it should be fixed. Then the second word is day. So as day should be assigned that on Wednesday, on Friday, at PHC, at CHC, at district hospital, you will have operation. Operation will be done. And what is static? Static means it is fixed. The doctor means surgeon or gynecologist, he or she should be there posted. Ideally what we want, if a doctor is posted at the PHC or at the CHC, and he is a surgeon, so you don't the seasonal thing means you have to call it, you have to plan a date, then you are calling a surgeon, all those problems will be removed, because you have a doctor day and night, 24/7, he is there, he is practicing, he is employed to that place. So the Supreme Court said that plan like fixed day static strategy. What is the static? Means your health facility should be static, the doctor is also there. So the only thing which has to be done, the beneficiary has to come, and you need to do the family planning program means permanent method of sterilization. This was a very good initiative taken. Now also it is very difficult for government of India and the state government to conduct fixed day static strategy at all places. Why? Because we have shortage of doctors. But then also what improvement has happened, students, that actually the operations are happening in the hospital. You have a facility now, and you are calling a doctor who is recognized, who has been approved by the state government, and he is doing the operation. Initially we were not aware where the camps are organized, what measures are been taken, all facilities are not there. So when this Devika Biswas filed a case against the government that what is going on, operations are going on in Panchayat Bhavan and all those, and no aseptic measures are taken, no operative procedures are followed. Then the Supreme Court came heavily on the government and they said to formulate this strategy, and this is implemented now. So it's a very important thing which you should know. Okay. So I'll end it here now, students, and I'll be taking another sessions, so 2 or 3, 4 sessions on this. So this is Unacademy platform at 10 o'clock, students. Please join just after 20 minutes. I am taking class on biostatistics, the portions which were remaining, 10 to 11 and 12 to 1, 2 classes. If I am able to complete it 10 to 11, then 12 to 1 will be taking numerical based questions in epidemiology, biostatistics, vital statistics, and if it is if not, then we'll be taking statistics also. So 10 to 11 is statistic, 12 to 1 also numerical based questions and also statistics there also. So I'll request you all people, various courses are going on Unacademy platform, and you have live class, you can discuss with your educators, and you can have doubt clearing session, quizzes are holding on. So this is the way you can, this is my code, drrama-yt. So you can use this if you want to join. I advocate that you should join because it's a good platform for you all people to learn. So with that note, students, thank you very much for joining, because sharp 10 o'clock we'll be starting the discussion on biostatistics on Unacademy platform. So I request you all people to join, and I also request your colleagues also who are there, if they want they can join. It is free, it's a special class, you can join and we can have a great discussion, students. Okay, so with that note, thank you very much. We'll be taking national health programs on YouTube subsequently, don't worry. So this was just a start. So, and we have discussed about NACO, we have discussed about RBSK, RKSK, family participatory care, family planning programs, national health missions, health system strengthening. So this is the way you learn the program. Programs will be only learned when you know how it is implemented in the field. Program you will always forget, students, when you will read from the book and you think you will remember. You are bound to forget. 102 ambulance, if you see, you never forget. 102 ambulance, when you read, you forget. 108 ambulance, when you see on the ground, on the roads, you remember, okay, this is 108 for emergency, 102 for Jani Shishu Suraksha Karyakrams. You remember those. You see mobile medical unit. The moment you see the mobile medical unit, it will help you to remember, okay, for 10 lakh we have one mobile medical unit.